Counselor versus psychologist versus psychiatrist. Which mental health professional do you need? Feeling overwhelmed and need professional help but confused about whether to see a counselor, psychologist, or psychiatrist? You're not alone. By the end of this video, you'll know exactly which mental health professional is right for your specific needs. Let's dive in. Hey everyone. If you've ever felt lost navigating the world of mental health support, today's your lucky day. I'm breaking down the key differences between counselors, psychologists, and psychiatrists in simple terms that actually make sense. Plus, I'll give you a quick decision tree at the end to help you choose. So let's get started. First up, let's talk about counselors, also known as therapists or licensed clinical social workers. Think of them as your emotional support specialists. Education and training. Counselors typically have a master's degree in counseling, social work, or a related field. They've completed thousands of hours of supervised practice before getting licensed. What they do: provide talk therapy and counseling sessions, help with relationship issues, grief, anxiety, and depression. Use techniques like cognitive behavioral therapy, mindfulness, and solution-focused therapy. Create safe spaces for you to process emotions and develop coping strategies. What they can't do. Here's the key. Counselors cannot prescribe medication. They focus purely on therapeutic interventions. You should consider a counselor if you're dealing with life transitions, relationship problems, mild to moderate anxiety or depression, grief, or just need someone to talk through your challenges with. Next, we have psychologists. Think of them as the detectives of the mind. Education and training. Psychologists have doctoral degrees, either a PhD or PsyD in psychology. This means they've spent 7 years in graduate school, plus internships and supervised practice. What they do, everything a counselor does. Plus psychological testing and assessment. Diagnose mental health conditions using comprehensive evaluations. Conduct neuropsychological assessments. Provide specialized therapies for complex conditions. Research and develop new treatment approaches, what they usually can't do. In most states, psychologists cannot prescribe medication. However, in New Mexico, Louisiana, Illinois, Iowa, and Idaho, specially trained psychologists can prescribe certain medications. Consider a psychologist if you need psychological testing, have complex mental health conditions, want specialized therapy approaches, or need a formal diagnosis for conditions like ADHD, autism, or learning disabilities. Section 3. The psychiatrist, your medical mental health expert. Finally, let's talk about psychiatrists, your medical mental health experts. Education and training. Psychiatrists are medical doctors who've completed medical school, a residency in psychiatry, and often additional fellowship training. We're talking about 8+ years of education after undergraduate studies. What they do. Everything related to the medical side of mental health, prescribe and manage psychiatric medications, treat severe mental health conditions, provide medical evaluations for mental health symptoms, handle complex cases involving multiple medications. Some also provide therapy, though many focus primarily on medication management. What makes them unique? They're the only mental health professionals who are medical doctors, which means they understand how mental health intersects with physical health. You should see a psychiatrist if you think you need medication, have severe symptoms, have tried therapy without enough improvement, have complex medical and mental health issues, or need medication adjustments. Okay, here's your quick decision guide. Start with a counselor. If this is your first time seeking help, you want to talk through problems. You're dealing with life, stress, relationships, or mild anxiety, depression. You prefer non-medication approaches. Consider a psychologist if you need testing or formal diagnosis. You have complex mental health concerns. You want specialized therapy techniques a counselor has referred you for. See a psychiatrist if you think medication might help. You have severe symptoms. You've tried therapy alone without enough improvement. You have both medical and mental health. Remember, these professionals often work together. Many people see both a counselor or psychologist for therapy and a psychiatrist for medication management. And there you have it. The main differences between counselors, psychologists, and psychiatrists. Remember, seeking help is a sign of strength, not weakness. And the most important step is just getting started. If this video helped clarify things for you, give it a thumbs up and subscribe for more mental health content that actually makes sense. Drop a comment below which type of professional sounds right for your situation, or what other mental health topics would you like me to cover.